I wanted to say hello and thank you for joining us today. My name is Erin Tinnen with the National Center on Domestic Violence, Trauma, and Mental Health. Today's webinar will be Responding to Mental Health Crisis, Incorporating Peer Support Practices. Our trainer today will be Cathy from the National Center on Domestic Violence, Trauma, and Mental Health. Before we get started, I'll go over some of the technical details of the WebEx software that we will be using for today's webinar. Many of these details are explained on the Using this Webinar System tab on the upper left-hand side of your screen as well. Please be aware that your screen might look a little different depending on whether you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. The second from the top is the chat feature. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with the trainers or myself if you have any questions regarding the training content. To do this, click the down-facing arrow and select the person you would like to contact. You'll see a lot of options, but for this session, you'll want to select all participants if you would like to respond to a question from the trainer or contact me anytime during the session. You may also contact Angelica Medina if you have any questions troubleshooting the WebEx software. So let's test this chat feature. Will everyone please go to the chat box, click on all participants, type in the program that you're calling from, and then press enter. Just waiting to make sure that that works for folks. So folks can click on all participants. Oh, great. Thanks, Cynthia. I know that it works, at least for one person. So if people want to continue to do that and add your program name, that would be great. So while folks can get a lot out of the chat feature, there are times when it moves really quickly and can feel distracting. So if this is true for you, you can feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there is a media viewer box. This will contain the captions. If you do not want to see the captions, click on the down-facing arrow next to the word media viewer, the same way you might if you want to hide the chat box. At the end of the webinar, you'll be taken to a very brief evaluation. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes the sound cuts out due to internet connection, so feel free to call in if that is a problem for you. If you're experiencing technical difficulties and are unable to contact me directly, you may call WebEx Tech Support to resolve any additional issues. That phone number, which we will also post in the chat box, is 1-866-229-3239. Again, thank you so much for your patience in our late start, and thank you for joining us today, and I will now turn the training over to Cathy.
Technical assistance and really both of you to helping get this to happen today. I apologize to everyone for the technical difficulties, and what you see in front of you is a little bit of information about the center, and I just wanted to stop and encourage folks to visit the website if you haven't and look at our extensive resources, and just would like to extend the invitation for that to happen. So today we have about a little less than an hour, and we're going to spend some time talking about peer support. So peer support has roots in the mental health system and started as a protest movement that was really about demonstrating that people who have experience within the mental health system and using services have much to offer. And it parallels with domestic violence advocacy and advocacy in our sexual assault work in that there's some alignment of purpose, there's some alignment of values, and there are some times when folks are in crisis in domestic violence and sexual assault advocacy services where a connection to peer support in the community may be a useful resource. And again, my name is Cathy Cave, and I've worked with providers in domestic violence and sexual assault work and in peer support and mental health work. So I have this unique view around how we navigate in all of these communities. And as a survivor, I spend lots of time actually sharing my story, my life, my experience in ways that I think is supportive and helpful to others, and that is at its root what peer support is all about. So our objectives today are to consider mental health peer support as a resource in our work and to explore the alignment between domestic violence and sexual assault violence, sexual violence and advocacy, and think about it in terms of how can we work together, partner effectively with peer support programs in our communities. And then lastly, to explore opportunities for cross-training, effective partnering, and really bringing trauma-informed peer support to survivors that are in all of our programs. First, I'd like to ask folks to just take a moment and breathe, and I'm going to do that myself. And this is a picture from Ketchikan, Alaska, that I thought I'd share. At the center, when we talk about the work that we do, these are some of the pieces that we're holding. So what we call this is an integrated framework, and many of you have seen this before. And we talk about that while we're doing our work in domestic violence advocacy and sexual assault advocacy, that we're holding a human rights and social justice lens. We're holding that perspective. At the same time, we're thinking about culture and community and recognizing differences in identity, differences in expression, differences in how we think and feel and what we value, and that is equal to the lens that we bring around being trauma-informed and equal to what we bring around really understanding the dynamics of interpersonal violence. So it's holding all of these pieces together and thinking about it, our work, and thinking about folks' experiences in terms of being survivor-defined, that there's a focus on physical and emotional safety, that we honor hope and resilience, and really value relationship and connection. And when I think about kind of the role and the practices of peer support, it's around that relationship and connection that we have the most opportunity to be effective. This webinar is part of a series that we're in the middle of. This is part 2 of really thinking about crisis in our programs and what does it mean when a person is in crisis, if survivors in crisis, or staff, as we're working, we are in crisis, and that we're all part of the mix. So when we look at how to navigate crisis in effective ways, it's really what's in the whole environment, who's in the whole environment. So there's a person who's experiencing distress, there's a person or people who are helping, and then there are other folks who are present and maybe in the mix or in the environment or around the edges, and there's roles that all of us can have in being helpful. So when we're thinking about it and talking about this in future webinars, we'll keep coming back to this diagram because it really does provide a very quick picture around the whole environment, navigating crisis, and who do we need to consider as we do our work. Tools that help us provide trauma-informed crisis support. So again, this is as part of a larger series. These are some of the things that we'll be talking about. So in our initial webinar, we talked about and did an overview of all of these pieces. Today, we're going to focus on organizational practices, which include peer support and an opportunity to increase connection, increase opportunities for people to connect. And in future webinars, we'll be talking about additional organizational policies and practice. We'll talk about mind-body healing practices. We'll talk about paying attention to our physical and sensory environments, asking about what helps when people are in distress, and then having some ideas for when people can't tell us. So again, this is part of a larger series, and we'll be talking about all of these topics. In thinking about peer support, there's an opportunity that we have to offer something new, something different, something that's proven effective when someone's in crisis and making a connection. So sometimes as a staff person or as an advocate, I might not be the one to make the best connection in that moment. There's other times when I am. There's other times when someone who I know has a shared experience, someone who I know and believe understands where I've been and where I'm going, can offer an additional opportunity to navigate crisis. So that's what peer support's all about in terms of within the context of domestic violence and sexual violence advocacy work. So it's another opportunity to offer a connection that supports folks. So it helps, I think, to define peer support. So when we talk about it, there are lots of different beliefs about what peer support is and what it looks like, who's involved in it. So we're going to spend a little bit of time talking about what it looks like, what does it mean, that there are a range of views in terms of how people think about peer support. So again, this comes out of distress that people were feeling in the mental health system, and this movement evolved that basically says there's a different way to be. So treatment can be helpful, supports can be helpful, there are clinical practices that can be helpful, and there are also folks who have been harmed in the system who said, there's another way, we want to do it this way. So there's a long history and rich tradition around peer support. And really thinking about it in terms of a dynamic, flexible approach to connection and mutual understanding among equals based on a core set of values and principles. Over the past decade or so, there's been a great deal of conversation in the peer support movement about how does this movement become trauma-informed? How do we think more about the impact of trauma on all of our lives? Because when we think about it, when we look at the research, nearly 100% of people who have been within the mental health system, who have been treated in the mental health system for long term, near 100% are trauma survivors. So now that we have a better understanding of trauma and its impact, there's an opportunity to really think about how do we bring this conversation to peer support. So that work has been happening over the last decade. Several folks, Darby Penny and I have been involved in this. Lots of systems have been involved in this. And there's an organization that does and leads with what's called intentional peer support. And I put a link in our resource list at the end that will let folks have a connection to intentional peer support. You can get more information about that. So again, it's the idea of peer support is opening up this connection that's based on equals. There's mutuality is at the center of that, and there are a few other values at the center of that. But there are guiding principles and practices to how people proceed. I wanted to take a moment before we talk about the values to take a look at the range of views of folks who have been treated in the mental health system, have used mental health services, or have participated in peer support. So there's no one way that describes the universe of folks who have engaged in these conversations. So these are samples of some of the views that, and diversity within what does it mean to define yourself in this way. So there are folks who are unsure of or don't believe in or are opposed to diagnosis. So in their experience, the system was harmful, they don't want anything to do with it, and that the labeling or a diagnosis provides harm. And then other folks will say, you know, this diagnosis provided understanding, it's an explanation for what's been happening. Now I understand it. It's something that helps my life make sense. Some folks have said, you know, recovery and healing happening through treatment, and mental health therapy might be part of that, medication might be part of that. And other folks will say, you know, healing happened and recovery happened because I had this holistic approach and I work with someone who honored and respected that. And getting justice was part of that, and taking social action helps maintain resilience. So folks have had those sorts of views. And then there are other folks who have said, you know, they're unaware of the impact of trauma. What is this trauma stuff? Don't understand it. I don't know. I maybe need to learn more. And there are folks who are absolutely on board, really understand it, describe their own experience in terms of trauma and its impact, and understand and have developed new ways to cope. So as we're going forward, I would just ask everyone to hold that there's a range of views around mental health, around diagnosis, around treatment, around what was helpful, what continues to be helpful, and how folks describe their own experience. So how does peer support help? As we think about folks and their experiences with trauma, here's some of the potential sources of trauma. And I'm not going to review the whole list, you'll have that in front of you, but what I would ask you to think about is the one that's on the very bottom on the right, which is any misuse of power, by one person or group over another is a potential source of trauma. And that not any one person has the exact same experience with trauma or talks about it in the exact same way as any other person. Our experiences are unique, how we describe them are unique, the meaning we make of them are unique, and there are, of course, some commonalities. But what's really important is that when you talk with each person about, what's your journey been, what's your experience been, and in peer support we do this in a natural way. It's really honoring that we each have our own narrative. We each have a way of sharing that narrative, of describing it. Sometimes it's with words, sometimes it's with art, sometimes it's with music. But that whatever that journey's been, whatever those experiences have been, opening up possibility for folks to be able to talk about it. So peer support in its traditions does that. There's no assumption that we've all had the same experience or that that particular label or diagnosis describes what happened to you. So what's mutual about it is that it opens this door for understanding, and it opens this door for exploration around and encouraging and supporting. Tell me, share with me what happened in your time, in your words, in your voice, in whatever way that you want to do it. But when you're ready to do it, peer supporters are here. When we think about the ongoing impact of trauma, this is something that is also important for us to hold. We hold these experiences. Our bodies and brains are on constant alert for danger. That how this plays out is that it doesn't always feel possible to turn off the alarm. The coping strategies that we develop to stay focused, to stay present, to stay connected, to be a part of the conversation with other people are often strategies that increase risk or that may increase risk. So in peer support, there's, again, this understanding that we all have different ways of coping and that what we're coping with has the source of that is great harm, and what we're constantly looking to do is to get grounded, to get settled, to build new connections, to really talk about what some of those coping strategies are without fear of coercion from other folks, without fear of being locked up, without fear of being asked to leave. So peer support creates this opportunity that whatever you're experiencing, whatever that is, I'm here with you, I'm sitting with you, I'm open to you to share it and to talk about it. At the core of traumatic stress is a breakdown in our ability to regulate our internal state. So it's how do I think about, in moment to moment, I may be feeling different things, unable to express things, expressing myself in a way that other folks are uncomfortable with. And so as we're navigating trauma and its impact in peer support, there's an openness to whatever's happening for you in this space and in this time and right now, I'm here to be with you. So when you look at this list of what dysregulation can look like, it's how we navigate our thoughts and emotions, the physical sense of, where am I, how am I, what is my body doing, how aware of that am I, how's my energy, whether or not I can even express any of the things that I'm feeling and talking about right now. Do I feel connected, not feel connected? And how present am I? Some folks hear voices. Some folks really have a different sense of what reality is to them in any given moment. So, again, in peer support, within the context of the mental health system, folks are used to experiencing these things and being present with folks in a way that says, wherever you are, however you are, I'm going to sit with. We may not talk about it because that might not be effective right now, but I'll be with you while we do it. So it's really a sense of acceptance, of great patience, of really thinking through what's helpful, even when people can't tell us what's helpful, waiting until they can. And then over time, continuing to stay present, and that the relationship may shift. So I may not be able to feel internally connected to someone else right now, but in peer support, the person that I'm with or the group that I'm with is going to wait for me until I can feel connected. That I may not experience myself as deserving and worthwhile. The folks that I'm with will wait with me and help reinforce that I am deserving and am worthwhile just by their presence, just by hanging in. Whether or not we share verbally doesn't matter. It's if and when that happens, someone is going to be present and stay connected. So when we think about what it means to truly comfort someone else, at the times when we feel like we don't deserve comfort or that we can't be there to comfort someone else, in peer support, the message is, I'm here and I'll be here. So there's a way that peer support, because of the values and because of the guiding principles, maintains a connection in a different way often than what survivors' experiences have been in other systems and in other kinds of programs. So the values are these. It's voluntary. So one of the challenges around this is that often people will be mandated to peer support programs, but you can't mandate relationship. So even if someone is told you must go to this program, it's up to individuals to engage when they're ready to engage, to connect when they're ready, and that when they're ready, someone will be there for that. The idea of being non-judgmental. So in peer support, people are humans like everybody else. I think one of our great challenges is maintaining that sense of being non-judgmental. But it is a core value, and it's something that people involved in peer support, whether it's paid or voluntary, some people have jobs providing peer support. Some folks volunteer and do it because it's right and it feels right. That's always the goal, and that there's a deep and abiding respect for who folks are and how folks are, and that reciprocity is present. And what I mean by that is that because we're equals, if I'm having a hard time and having a bad day or having a moment, I can share that with you in the same way you can share that with me. So there's not a hierarchy because I'm not here to judge. I'm not here to make sure you do anything. I'm not responsible for what you say and do. I'm with you while you say and do it. So the importance of protecting our empathy so that we stay this open and connected is incredibly important in the work that we do. Shared responsibility for the relationship means that there's this constant negotiation about what is it that we're going to do together right now. So sometimes folks will want to just hang. Sometimes we might want to talk about something challenging. Sometimes I may have something I want to share with you. Sometimes you have something you want to share with me. But that conversation is negotiated each and every time we get together to talk. And there's probably some other guiding principles. And when I have this conversation in peer programs, we open it up to the group, and folks will think about, what other guiding principles are really important. So what I would ask folks to do, to use the chat feature if you like, if there are other guiding principles that you think are important in terms of what needs to come to peer support for you to feel comfortable either providing peer support, participating in peer support, being there as an equal in terms of how we move forward, what we're moving forward to do, and actually negotiating that in relationship every time we get together. So if anyone has something that you'd like to add, please go ahead and add it in the chat box. What peer support is not is also worth spending some time to think about because it's not a program model. So although there are guiding principles in, how we want to be, different programs are doing different things. So I work in an organization, for example, that our role in peer support is actually to provide training to peer support programs, and then other parts of our organization provide peer support daily. That's what they do. So some of it is on the phone, some of it is in person, some of it is skill building for people who provide peer support, some of it's educating the community about what peer support is. There are some consistent themes that peer support is not focused on diagnosis or deficit. So whatever someone's belief is in the range of views about what's happening for them and what they're experiencing, that's all good. You know, it's what you believe is what you believe, and in peer support, the idea is if there's something you would like to move forward to do or change or just have social connection, that all is welcome. But the focus is not what's the diagnosis and what's the symptoms, or what is it that they are not doing, and let's pick at the problem. It's also not about helping in this hierarchical way, which can be challenging in programs where peer supporters are paid. So there's lots of energy and effort and focus on understanding that even though my job is to be here to be supportive, my role is to join you and be with you to do whatever it is you want to do. So it's even as a paid position, it's not telling someone what to do. It's also not about being a counselor and having the answers. So in peer support, what folks are sharing is their own experience, strength, and hope, and in hope that that's helpful to somebody else. So it's not about the guidance and do this or do that or making recommendations or making sure that folks do what they're supposed to do. So we're not pressuring folks to comply with anything, whether that's treatment or any kind of other mandate. It's really a presence of someone who can be there to be supportive, to be with, when sometimes other systems and other folks can't. And it's also not about monitoring people's behavior. So it's really thinking about, in our relationship, what can we do together that's going to be respectful and kind and honor where you're at and where you'd like to be. So I wanted to also spend a moment thinking about who provides peer support. So who are those folks that do this work? Again, it can be paid or voluntary. Part of the thinking in that is that it was completely voluntary for decades and decades and decades. And now that more mental health systems are adding peer support components, that these are becoming paid positions. So more housing programs have peer support staff. Local clinics have paid support staff. Folks who are peers who want to start organizations have completely peer-run organizations where they provide community supports. So there are lots of different ways that folks can engage in being a peer supporter and really thinking about then as in domestic violence advocacy and sexual assault advocacy, how do we connect and take advantage of and really work with incorporating peer support as an option for people who are using our services. Everyone who is working in peer support, again, whether paid or voluntary, typically has experienced some adversity. And again, if you think back to that whole list of sources of trauma, many of us who are survivors have, many of those things are part of the mix. And the gift, I guess, in peer support is that you're living those experiences and describing those experiences out loud and with intention so that others can benefit in small ways and in large ways from what's being put out there. We talk about how we survived. We talk about whether it's in the mental health system or in our communities or in our families, whatever those sources of pain are, we talk about those things. And it's living on that edge and living those stories and sharing those stories out loud that actually is often the difference between what's helpful when people have survived interpersonal violence. So there's a connection around this happened or something similar happened, or I didn't have that exact experience, but something that resonates for me is this. And being able to share those stories of our own lives in ways that benefit others, have messages about hope, have messages about survival, and not that if I did it, you did it, but more I'm hopeful about survivorship. I'm hopeful about resilience because of these things. So those are the ways that folks can share their stories, share their experience, and again, when we work in programs, there's guidance, there's support, there's supervision, there's all of the things that make it possible to sustain ourselves in peer support as we do the work, in the same way that these are parts of our advocacy programs so that we can sustain ourselves, so we can continue to do the work that we do. As survivors, we often have a sensitive radar for detecting dishonesty and good reasons to be sensitive to the misuse of power and authority. How this resonates for folks and what this means in peer support conversations is that there's a level of detail to mutuality, sharing experience, not using power over, really providing choices and options and negotiating for what we each want from this relationship, what we each want in each conversation, that there's power in that and there's value in that because of the sensitivity and because of just recognition that life happens in ways where people use power over another, and when someone does that to another human being, it's detrimental to our souls. So coming back from that place where I feel like a worthwhile, productive, connected, grounded, and safe human being for myself, I can practice that more in these relationships, and it just becomes part of what gets passed on in peer support as people continue to meet each other and continue to connect with one another. A couple of other pieces that I think are important just in understanding peer support is that folks who are engaged in this see coping strategies, not symptoms. And so there is not a lot of talk about what my diagnosis is or what my label is. It's more, this is how I'm coping. These are the things that help me cope in good ways. These are things that I may want to change because this coping strategy puts me more at risk, or that this coping strategy leads to disconnection from people I want to be connected to. So we can have those real and honest conversations about those kinds of things. Helping survivors to make sense of how they're coping and surviving. Again, it's really looking at that. It's holding a mirror up to, yeah, I'm coping, and this is how I'm coping, and oh, that's what that is. That's a strategy. I want to continue to do that. I want to stop doing that. But it's up to me. It's not someone telling me you should or you need to. And also creates a safe space because it's not done with this power over. It's more from this mutual place. It's a really safe place for survivors to talk with each other about considering something new and the dignity of risk in considering something new when one of the ways of coping that someone might currently be doing is not helpful. We all have something we're sharing. Sherry Mead is one of the folks who's been central to this conversation around intentional peer support. And so there's no static role of helper or helpee, and that it's really about relationship and connection, and that the importance of relationship is elevated to be kind of at the top of the list of priorities. And this may be really very new when the messages that folks have gotten is that, you know, this is what's wrong with you, this is what you need to fix, this is what you need to change, and these are the services that will help you do that. Peer support more comes from a place of we're going to create community, so just defining community now means something different. You're active in this community of 2 or in this small group of 4 or however many it is, and that we all have something we're sharing. So no one needs to be more recovered than someone else, more healed from somebody else than someone else. We all have something to offer. So when we talk about our advocacy and domestic violence and sexual assault work and kind of the values and principles and practices of peer support, there are places where there is alignment in how we think about the work that we do. So here are some pieces of what it means to be trauma-informed. So it's knowing that violence is pervasive and people's experiences with violence and oppression are pervasive. So again, thinking back to that list of potential sources of trauma, there's so many different kinds of experience, and there's also so many experiences. And what we're all hoping to do in our work is to minimize re-traumatization and to really counteract what happens when people experience abuse. So how do we then create opportunities for honoring well-being and resilience and healing and safety and thinking about self-determination and agency as priorities for people's lives? And then really thinking about that as our organizations as a whole, we need to tend to the impact on providers, and that means all of us. So there isn't, again, this separation of, if you have a title, if you work in an organization, that you are somehow exempt from trauma. We're all in the mix here, and peer support really does believe that, and we're all committed to changing the conditions. So it's thinking about, can we engage in different ways to do that when peer support's part of our resource pool in our communities. So some of this I've already talked about, and one of the reasons we want to focus so much on mutuality and shared responsibility for the relationship is that when you have this support that comes from a top-down way, it doesn't always feel supportive. Sometimes helping isn't very helpful. So it can also reinforce feelings of helplessness and hopelessness, and it can imply that because your circumstance is different, that you may be more recovered or more healed than somebody else. And it can also convey that survivors are not capable of directing our own lives. So when we think about it then, the focus on mutuality really shifts those perspectives. And then living out loud really does challenge stigma. So when there's discrimination that's related to the fact that someone is engaged in the mental health system, uses mental health services, or really has some challenges around emotional distress, that peer support in and of itself challenges those notions, really does challenge the fact that we're not capable or we need to be managed, that there's much more diversity, much more openness, people have much more to offer, and peer support is one of the ways that we do that. Here are some ways that we can, again, look at trauma's impact, and again, I won't do all of the detail here, but when trauma does these things, it invalidates what someone's belief is and about who they are and what they're worth. It's filled with mistrust. There's loss of power and control, that folks don't have a voice, feel helpless and hopeless, and are feeling controlled by others and manipulated by others, and that our space and our voice and our boundaries have, very little meaning, that peer support can counter all of that when it's effective peer support. So there's alignment here, and what we know in our domestic violence, sexual violence, and sexual assault advocacy work is that we're working to counter these same kinds of issues and feelings and experiences all the time. So there's an alignment and vision of what we can do when trauma and violence are part of the picture to change the conditions. One of the other important things for us to think about in terms of peer support and our advocacy work is that safety is defined differently by each and every person. So if I have a room full of 10 people and ask, what does safety mean? What's physical safety? What's emotional safety? That people will have very different ways of describing what they need and what's helpful. So I wanted to just take a moment to just recognize that often in organizations, talking about safety is linked to risk management. In peer support and in peer-run programs, there's much more focus on providing safety as people define it, as each person defines it, and trying to think about and balance both safety and the dignity of risk, and making sure that people feel emotionally and physically safe, but also able to then speak for themselves and to say, this is what works for me, and to use their voice to say, not me, not now, not on my watch. And there's a way of, in the day-to-day work and peer support programs, to keep coming back to this theme about safety. And I think that is also very much in alignment with our work in domestic and sexual violence advocacy. So it's really thinking about how do we look for that in other places in the community. Who cares about what we care about? So there is this alignment. And as far as what helps, this is what helps. Being trustworthy, having some respect for agency and that people want to take action, that need justice. Choices are important, maintaining connection, sharing power. So there's alignment in the way we actually do work that says in our services, and when we look at allies in the community, there are folks who think about and are doing things in a way that aligns with how we want to do it and how we want to work with folks and how we honor people. So then to connect around community partnering, some things to think about are these, that peer support programs typically have a deep awareness about mental health systems and services. They know about resources, they know about ways to connect with folks who may be using services, who want peer support, connect to people who don't know anything about peer support, way of bringing peer support conversations into new settings. They're great at that. How to advocate within the mental health system, great at that. They can be a great partner around those kinds of things. They could also be a great partner for someone who's in distress when you have relationship as a provider, and really thinking about, who might we include as our resources in our community that can help when survivors are experiencing distress. I think where folks in peer support need more information is around the dynamics of interpersonal and gender-based violence, that they may not be thinking about that, may not have an analysis or an awareness, and I think that there's an opportunity here to address that and really think about that in terms of cross-training. So in the same way, as part of our domestic violence advocacy and sexual assault advocacy, we're constantly educating community partners that here is another source for partnership that often goes unnoticed in communities. So as providers doing what we do, really looking for peer support programs as potential allies and looking to thinking about what do we need for cross-training? How can we educate them? So often folks will think about, and in the peer support realm, will think about trauma in terms of childhood trauma. We'll think about it in terms of institutional abuse. We'll think about it in terms of things that might happen in community, but not necessarily think about sources of trauma that have to do with interpersonal violence and gender-based violence. So there's an education curve that I think as advocates we can help bring folks up to speed. So if we provide that same education that we give to other kinds of social service organizations, mental health providers, police, substance use programs, it's thinking about here is another resource that's a community partner that if we can educate, support, guide, and continue the conversation, then we have an opportunity to change resources that are available in the community for folks that we all care about. The other piece is that more peer support programs are growing throughout the country because there's a push around Medicaid and managed care that this is now a billable service. So more mental health programs will have peer support as part of their resources. And peer supporters are often, even when they work within clinics, have a greater capacity to do more outreach, to go out into the community for partnering, to be at events, to participate in conversations. So years ago, I was part of a partnership with the Sexual Assault Coalition here in New York State, and in our partnership as a Mental Health Association in New York State, we went county by county to every county in the state and talked about trauma together as a training team. And out of those conversations, groups developed that later became a task force or a learning community that was focused on sexual assault and domestic violence and mental health, and how do we continue to have these conversations. Years later, several of these groups are hosting joint trainings still. So I just would make the pitch for that there's a partnership here that has gone unrecognized and I think underutilized and has great potential. So bringing peer support directly into our advocacy services can be helpful. However, if we can't get folks from the outside to come in because of safety and confidentiality, there are some of the traditions and practices in peer support that can be helpful that we can use within peer support, within domestic violence programs and sexual assault programs. So really sharing information about trauma and its impact. So if we want folks to talk with each other in ways that really does honor and pay attention to the fact that we're all in pain and we're all constantly healing, educating people about what is trauma, what's the impact, and how can we be more generous with one another, more honoring of each other's resilience, that we don't have to engage in competition, that we don't have to have contention when we talk about our experiences. So really talking about trauma and its impact in a very direct and straightforward way. Really supporting survivors' efforts to be there for one another, and again, part of that is really sharing with people how to do that. Really sharing what peer support values and practices are. So there are lots of programs around the country. Most states have, at the state mental health office level, have an office for peer support, and they can be a resource for sharing documents on values and practices of peer support. So you can bring information in if you can't bring people in. And then offering training on peer support for staff. So how do we bring this information to our programs if we can't bring it directly to survivors through peer support programs? And how do we work to bring it in and bring the concepts in, bring in information, bring in possibility, really create opportunities for people to connect around it? And again, we are all continually healing. So again, no one has to be more recovered, more healed. We all have something to give and offer. And at the basis of resilience is consistently trustworthy and nurturing relationships. And peer support can offer that. I wanted to share a quote that a friend of mine found for me, and I know there is strength in the difference between us, and I know there is comfort where we overlap. And for me, this really does signify what peer support is all about, that it's in our difference, it's in our, and in our willingness to connect, that we can be here for each other in ways that are helpful. Here are some resources. I wanted to mention a couple. So the Intentional Peer Support Program, Sherry Mead is the person who did the lion's share of the work in starting the program. There's lots of information, lots of training available. An organization that's here in New York is the Mental Health Empowerment Project, and this is the only statewide mental health program that's completely peer-run. The board, 100% of the staff, and all the folks who provide peer support. And then there's a document that a few of us helped to co-write a couple of years ago, and it's called The Guide for Engaging Women in Trauma-Informed Peer Support, that really talks about how do you bring the conversation in. The guide is used in lots of different ways. People, share pieces of it. You can download it for free. It's the only way you can get it. And it's been helpful for folks in different ways. Sometimes groups pick it up and they self-start and they just talk about the topics that are in it. Sometimes folks are doing more formalized meetings and really talking about what's in it. But it really does speak to the values of peer support, how we talk about trauma, and how people can connect to one another. And then I thank you all for your time and attention today. Really appreciate that you hung in here with this conversation, and if anyone has questions, we have a few minutes.
So if folks want to post questions in the chat, we can have Cathy answer them. Give folks a couple minutes just in case.
Sure. I'm going to put my quote and the picture back because it's pretty.
Great idea.
I think I will take a minute to address a question that often comes up, and it's, in peer support, if the conversation doesn't go well and someone's upset or angry, what happens? And when you have shared responsibility for the relationship, what that means is anyone can say, I'm not comfortable with this, or I'm angry, or there's a whole host of ways that folks are really encouraged to speak their truth in that moment. So it's part of what strengthens folks getting reconnected and regrounded and having relationships that feel safe and comfortable, because the power truly is shared. So it really is about, my no has meaning, and so it can be helpful in that way too.
Thanks for sharing that.
Sure.
So it doesn't look like, the guide. You know what? I will, someone just asked a question about the guide that you mentioned at the end
Sure.
that you did with NASHBID. I'll be sure to include that in my follow-up email so that folks
Great.
can have a copy to that, or a copy of that or access to it. So, so I think if folks don't have any other questions, we can probably just wrap up for now. So thank you so much, Cathy, for such a wonderful webinar. We want to thank Caption Colorado for providing today's captioning, and thank you to Angelica Medina for making the webinar run smoothly. Last but not least, thank you all for spending your time with the center. Within the next week, sort of as I mentioned, I'll send you all a follow-up email with a link of the recording of today's webinar, in addition to the slides and handouts referenced, including that last guide, all of which will also be available on our website. I will also include the presenter's contact information in case you want to get in touch with Cathy about any additional specific programming, and you will all receive a certificate attendance for your time today. At the end of the webinar, you'll be taken to a really brief evaluation. If you could please take a moment to let us know what was useful and what could have been better, it would be greatly appreciated. And thank you all again, and we hope you have a great afternoon. Take care, everyone.
Thank you.
Thank you.